Good afternoon, everyone. My name is Tanya Stillwell, and today we are diving into an innovative and impactful approach to improving the lives of adults battling substance use disorders. This discussion will be going over this poster presentation right there, based on the adjunct treatment intervention for adults with substance use disorder step by step, from defining the problem, formulating an intervention, and searching for the evidence, appraisal of the evidence, planning, implementing, and dissemination. Imagine if we could incorporate a simple yet powerful intervention into existing treatment regimens that not only addresses physical health, but also significantly boosts emotional well being. This is where this project comes in. By implementing structured physical activity into treatment plans, we aim to offer a multifaceted solution that can reduce cravings, alleviate depression and anxiety, and ultimately enhance the overall quality of life for individuals with SUD. This poster presents an evidence based approach to enhancing emotional well being in adults with substance use disorder through physical activity. The intervention incorporates structured physical activity programs into treatment regimens supported by substantial evidence demonstrating improved emotional states and reduced cravings. Substance use disorder is a complex and pervasive challenge affecting millions of individuals and their families worldwide. Traditional treatments often fall short in addressing the holistic needs of these individuals, particularly their emotional well being. The healthcare problem of untreated substance use disorders significantly impacts the emotional well being of over 20 million Americans. Traditional methods often fail to address this crucial aspect of recovery. By incorporating a structured physical activity program into substance use disorder treatment, we aim to improve emotional states, reduce cravings, and enhance overall well being. Watson's theory of human caring is the foundation of this intervention. This approach emphasizes caring for the whole person, physically, emotionally, and spiritually. By incorporating physical activity into SUD treatment, APRNs can offer well rounded care that helps individuals find balance and harmony in their lives. Ultimately, holistic care is the key. The proposed intervention involves integrating a structured physical activity program into the outpatient treatment regimens for adults with SUD. This program includes supervised exercise sessions, educational workshops on the benefits of PA, and personalized fitness plans. By integrating these components, it is anticipated that significant improvements in the emotional states of participants, helping them manage cravings, reduce anxiety and depression, and enhance overall well being. This holistic approach not only addresses physical fitness, but also promotes mental health, which is crucial for recovery. Several studies provided strong evidence supporting the integration of physical activity into treatment for substance use disorders. A systematic review by Lee found that moderate intensity exercise improves depression, anxiety, and cravings. Similarly, a randomized controlled trial by Zhu demonstrated that a 3-month PA intervention significantly improved emotional states and reduced cravings. Additionally, a mixed method study by Jimenez Meseguer showed that PA enhances quality of life, physical fitness, mood, social interactions, and reduces stress and anxiety. These findings show the importance and the practical benefits of incorporating PE into substance use disorder treatment programs. A synthesis of the literature consistently supports the integration of physical activity into outpatient treatment strategies for substance use disorders, demonstrating significant improvements in emotional factors and cravings. Based on this strong and consistent evidence, it is recommended to implement PA as a standard component of SUD treatment. PA aligns well with holistic treatment approaches and requires minimal resources beyond initial training, making it feasible in a low-risk adjunct therapy. Furthermore, it is highly suitable for enhancing the emotional well-being of SUD patients, making it an appropriate addition to their treatment plans. To measure the effectiveness of this adjunct intervention, several tools will be used to assess patient outcomes. The primary tools used include the Beck Depression Intervention Hamilton Anxiety Rating Scale, and Visual Analog Scale for mood assessment. They will track changes in scores from baseline to 1.5 months and again at 3 months post intervention. The goal is to observe improved emotional states, reduce cravings, and enhance mood among participants. To implement the physical activity intervention using the Johns Hopkins PET model, the team will start by recruiting an interprofessional team. This team will include nurses, physicians, mental health professionals, peer support specialists, CADCs, social workers, and a psychiatric mental health nurse practitioner as a product manager. They will identify key stakeholders such as patients, healthcare providers, clinic leadership, local communities, judicial authorities, insurance companies, law enforcement, and families. So, this is a detailed action plan to effectively implement. The team will partner with substance use treatment centers and related facilities to recruit eligible patients, sharing information about the benefits of physical activity. They will develop tailored exercise programs for each patient, focusing on moderate intensity activities like walking and jogging. Training sessions for healthcare providers will emphasize the integration of PA into substance use treatment plans, supported by clear guidelines. Motivational strategies will be employed to encourage participation by highlighting the benefits such as reduced cravings and improved emotional health. Collaboration with legal authorities will help establish incentives such as sentence reductions for program participation and completion. Detailed records of attendance, exercise performance, and patient feedback will be maintained. Emotional states will be regularly assessed using the Beck Depression Inventory, Hamilton Anxiety Scale, and Visual Analog Scale. After 3 months, the impact of PA programs on emotional states and cravings will be evaluated. They will compare pre- and post-intervention scores to measure improvements. Reference findings from systematic reviews that demonstrate significant reductions in withdrawal symptoms and enhance mental health through exercise. Finally, feedback from the staff and patients on the program's effectiveness will be collected to ensure satisfaction and continual improvement. Based on evaluation outcomes, long-term integration of physical activity into SUD treatment will be planned to ensure the benefits extend beyond the initial intervention period. The findings will be disseminated through journal publications, seminars, conferences, and internal sharing to highlight the positive impact of physical activity on substance use disorder treatment. This plan demonstrates a commitment to excellence and continuous improvement, ensuring the best possible outcomes for patients. The implementation of physical activity intervention will follow a structured timeline divided into 4 key phases: planning, implementation, evaluation, and dissemination. From July 1st to July 15th, 2024, the planning phase will involve gathering a diverse team, defining the problem, refining the evidence-based question, identifying stakeholders, and setting up leadership roles. From July 15th to August 1st, 2024, the implementation phase will focus on creating an action plan, securing resources, and kicking off the intervention on August 1st, 2024. The evaluation phase, running from August 15th to November 1st, will include initial assessments, ongoing evaluation, and midpoint check on September 15th, and a final evaluation on November 1st to gauge the intervention's effectiveness. Lastly, the dissemination phase from November 15th through December 31st will involve sharing results with stakeholders, identifying next steps, disseminating findings by December 1st, and preparing for long-term integration and ongoing communication. In summary, our intervention to incorporate physical activity into treatment regimen for adults with substance use disorder is a comprehensive, evidence-based approach that targets both physical and emotional well-being. Ultimately, this approach not only addresses the immediate challenges of substance use disorder, but also empowers individuals with the tools and support they need for long-term recovery and improved well-being. Thank you for your attention, and I look forward to any questions or discussions you may have. My email is listed below, and also, if you did not suffer horribly, feel free to push like on my video. Also, I always welcome more subscribers for my YouTube channel. Thank you.